Welcome to Nurse on the Go video for today. Today we're going to do male catheterisation. So today we're going to explain to the patient what we're going to do, reinforce that we're going to protect their dignity, keep everything private because it is quite an embarrassing situation, and tell them about the sensation, especially with male catheterisation. They get a longer burning sensation, so you've got to explain that, and that they'll have this feeling of wanting an urge to wee, so you've got to pass that on. When we've explained, we'll do a non-sterile wash, so we'll expose the area but keep like curtains and everything closed. So we get if they can't get up for a shower, preferably get up for a shower. If they can't, just get some wipes and some warm soapy water, and we start by just washing the shaft of the penis, wash all the outside, get all the debris off and discard that. And then if they do have a foreskin, we have to get right behind, so you have to retract the foreskin, make sure you can get it right back and clean around the back of the meatus of the foreskin, so make sure it's all nice and clean. Alright, and keep it back there just for the procedure, but remember at the end to pull the foreskin back over because you can get a stricture there. Sometimes, especially elderly men that have had incontinence pads on for long periods of time, they can get a lot of infections in the foreskin, and it will actually stay quite tight and restricted around the head of the penis, and you won't be able to retract it back. If that happens, don't proceed with catheterisation. Inform medical staff, and they'll give you some suggestions of what to do. So we've cleaned the area, so I'll take off my unsterile gloves. Okay, so put on my sterile equipment. Now I wear two sets of gloves, one to do a sterile aseptic clean with chlorhexidine, and then I have the set of sterile gloves underneath that to insert the catheter. So I have my chlorhexidine here in my cotton balls. I have a bit of gauze. We have some lubricating gel with a bit of lignocaine in it, so we've got to put that in as well, but I'll give it clean first. Now with the lignocaine gel, make sure that you let it work for 4 minutes. It does take 4 minutes to work. You can't just bang it in, say, yeah, that's good, and slap in the catheter, because you wouldn't have time to have effect. I get my water. Now, if you're a single operator, you don't have any help. Because the water is in an unsterile container, I put it underneath my drape, insert the end of my syringe, aspirate out my water, and that way I'm staying sterile while still getting my sample of water. Usually I keep the blue covering over the IDC, but today I just want to show you the technique using a pair of forceps, because that's another way you can do it. So first of all, we'll clean the area. Okay, so we get our sterile stuff. So we start at the urethra, give that a good clean, and just circle motions all the way around. So discard that, and then round all the way to the base of the penis, making sure it's all clean as such. Then we'll get rid of that. So now I take off my top layer of gloves. I get a drape and make it a lot of drapes in IDC packs don't come fenestrated, so you just got to tear a little bit, put it around the penis because we want to keep it sterile. And then the other drape that usually comes in the pack I put underneath, so I've got a big sterile area here that I can use to insert. If we need a specimen, this is where I put the specimen jar here. Take the lid off because you'll only have one hand to do everything. Have my water ready to go. Have my catheter, everything ready. So now I'll insert the gel. So do a bit around the tip first, and then slowly push in the tip into the urethra, squirt in the gel. Now you'll find it will come back out, so you've got to squeeze the urethra, hold it in there for 4 minutes. The patient will feel an urge like they want to wee. Just explain to them that, we're putting in the gel. It will make you feel uncomfortable, but in a couple of minutes we'll put in the catheter. So if I had a time-lapse camera, we would fast forward 4 minutes. I get my kidney dish with my catheter, pinch it at the end with the tweezers, gently push it into the end of the urethra, and use the tweezers just about 2 centimetres at a time. Push it in. Now you'll feel some resistance as it goes over the sphincters. So when you do, just hold it there for a second on the sphincter, just a light bit of pressure, and it will gently fall over the top. And then you just keep inserting. Now sometimes, like penises don't stick out this well. Sometimes they're little stubby ones. So you have to really push back the foreskin, get right in there to find the penis to get it out. Sometimes penises are quite long. They come in all shapes and sizes. And sometimes, you have to push the catheter right to the end just to get into the bladder neck. So just be aware that, not everyone is built equally. So there we go. So we've got it in, alright. And I'll get a sample while I can, so I'll get a bit of a sample. Then I'll get my bag, put my bag on the end, because you don't want it dripping everywhere. And at this point, I'll get my water, blow up the balloon. So I'm going to put in about 6 mils this time. Gently pull back on the catheter till it's nice and firm there. Okay, so it's sitting at the bladder neck there. Let that drain. Now this is the important bit. If they've got a foreskin, make sure you roll the foreskin back over. Because if you don't do that, they can get a stricture, and then that might have to be surgically repaired. So make sure you pull the foreskin back. And then we can either secure it to the inside of the leg or just on the thigh with a securing device. That's all for today's lesson. I hope you enjoyed it. Thanks for watching Nurse on the Go videos.